Bismillahirrahmanirrahim. Assalamu alaikum. I'm Abdul Hadi Khan and I'm a student of 5th Prof Morning. The drug that has been assigned to me is Abacavir. The rational uses of this drug includes its use for the treatment of HIV infection. And the side effects includes hypersensitivity reactions, and the hypersensitivity reactions can be in the form of fever and rashes. Some respiratory symptoms such as cough and pharyngitis, and some constitutional symptoms such as generalized malaise and fatigue. The GIT symptoms include nausea, vomiting, diarrhea, and abdominal pain. The dose in adults for HIV infection is usually in combination with other agents, and the dose is 300 mg per oral every 12 hours or 600 mg per oral every day. The dose in peds whose age is less than 3 months, its safety and efficacy is not established. But peds who are older than 3 months, the dose is usually 8 mg per kg every 12 hours or 16 mg per kg per day. And the dose should not be exceeded than 600 mg per day. The drug interactions include methadone, tenofovir, orlistate, and didanosine. This drug should not be co-administered with all these drugs. The dose adjustment is required in case of hepatic impairment. If the hepatic impairment is mild in adults, the dose should be reduced to 200 mg every 12 hours. But if it's moderate to severe, then this should be contraindicated. Drug toxicity. The hypersensitivity to Abacavir is normally immunologically mediated, and it's driven by conventional MHC1 antigen presentation and activation of HLA-B570. The activation of HLA-B5701 restricted CD8 plus T cell results in the secretion of inflammatory mediators. It is thought that a derivative of the Abacavir producing binds to an antigen presenting cleft unique to HLA-B5701, which explains why the drug does not cause a similar hypersensitivity syndrome in carriers of other HLA-B alleles, and why compounds similar to Abacavir do not react with HLA-B5701. Most cases of liver injury associated with Abacavir are mild and resolved rapidly within 4 weeks of the discontinuation. So we do not require as such special antidote in order to treat the hypersensitivity or the liver injury. The best alternatives of Abacavir include lamivudine, which is more potent and it does not cause hepatotoxicity, and didanosine, which does not require dose adjustment in hepatic impairment, so can be given to patients with hepatitis. The alternative brands of Abacavir in terms of pharmacoeconomics includes different combinations. Now, the combination with lower price includes the Abacavir, and the combination with higher price includes Triamic. Both of these combinations include different drugs. The lower price combination includes Abacavir, lamivudine, and the higher price combination includes Abacavir, dolutegravir, and lamivudine. In some notes, a 29-year-old male with a history of herpes simplex virus, HSV, and syphilis has been newly diagnosed with HIV. And there is negative screening result for HLA-B 5701 and is taking valacyclovir. Now, the chief complaint includes the HIV and herpes, and the history. The patient has history of the herpes and syphilis. Now, the planning for the patient includes Abacavir 300 mg per oral every 12 hours, lamivudine 300 mg per oral every day, and lopinavir 400 mg per oral every 12 hours. The patient has been taking some medication from before because he had history of herpes and syphilis, and that drug includes valacyclovir, 2 grams per oral every 12 hours. And he has also given the trimoxazole, which is initiated with this treatment. Thank you.